name is Caitlin Boykin. I chose HIV/AIDS for my final. For the sake of this video, I'm going to minimize myself so I don't interrupt any slides. What is HIV/AIDS? HIV is the human immunodeficiency virus. It is defined by the CDC, or Center for Disease Control, as a virus that attacks the body's immune system. HIV/AIDS is a sexually transmitted disease, or an STD. If HIV is not treated, it leads to AIDS. AIDS causes the person to have an extremely damaged immune system over time, and then it leads to the person having an increased number of severe illnesses throughout their lifetime. It is believed that HIV originated when hunters would come in contact with infected chimpanzees. They would come into contact with their blood, and this is how they would get it and then spread it from there on. HIV was a large topic in the 1970s. There was a large stigmatism around it because of the medical technology we had then. Not very many people survived once you reached HIV, and there wasn't very much research behind it. Now that is not the case. Contracting HIV, you contract HIV by coming in contact with an infected person's blood during unprotected sexual contact, sharing needles, or through pregnancy, birth, or breastfeeding. If you are a woman who has HIV and does not get treatment or just doesn't know you have HIV, when you become pregnant, you can transmit that to your baby. If you have HIV, if you knowingly have HIV, you cannot breastfeed. They do not recommend it at all, just because there still is a risk of transmitting to your baby even with you when you are treated. However, HIV cannot be contracted through sharing drinks, water, urine, kissing, saliva, sweat, or tears. The symptoms of HIV vary. They mostly include flu-like symptoms, as well as swollen lymph nodes, night sweats, and mouth ulcers. Not everybody who contracts HIV shows common symptoms. If you're sexually active, it's best just to get tested every 3 to 6 months. When you do become sick from HIV, they call this the onset virus. And most of the time, you do test positive for the flu when you go to the doctor, because HIV isn't something they test for right off the bat, typically. So if you go in with flu symptoms, they test you for the flu, you test positive, and over time, you just don't get any better. And typically, that's when they do more in-depth testing. At what point does HIV turn into AIDS? HIV turns into AIDS when it's left untreated for an extended period of time. HIV is considered AIDS when your HIV-1 test detects more than 100,000 copies of HIV per deciliter in your blood. HIV is a blood test, so most of the time, if you're wanting to get tested for HIV, they will just draw your blood, as well as take a urine sample and test for other types of STDs. AIDS is considered a stage 3 immunodeficiency virus, so once it reaches that point, it is untreatable. How is HIV/AIDS treated? HIV can be treated through medications that keep you undetected. Undetected is when you have less than 20 copies per deciliter of the HIV-1 virus in your blood. At this stage, HIV cannot be transmitted to another person. So when you're undetectable, you cannot spread the virus because there's such a little amount in your body. It can't spread to others, even through blood and sexual contact. Women who are pregnant and are undetectable have a 98% chance of having a healthy baby without HIV. And like I said earlier, there is no treatment for AIDS. HIV can be cured, but it's not a reasonable cure for this disease. There's only been 4 confirmed patients that have been cured from HIV in this process. The doctors will take out liters of their blood at a time, remove the copies of HIV, and reintroduce the blood into your body. It's extremely painful and expensive. Dr. Nate Smith compared this to dialysis of the blood. So they would just be taking it out, essentially cleaning it and putting it back into your body. But once your HIV has reached stage 3, the AIDS stage, there's no treatment options. What happens if you have HIV? There are many options for people with HIV. There are treatment options and organizations that help you pay for your medications, but because the pills for HIV can range anywhere from $200 to $500 per pill. Sometimes you take 1 pill a day. Sometimes you can take up to 5 pills a day, just depending on what stage you're at and how old you are, and if you're pregnant, if you're not pregnant. There's several different things that go into the medication for treating HIV. Once you're diagnosed, you will begin medications and doctor's appointments. When you start going to the doctor, you go once every 3 months and then for a year. And then after your first year, you'll go every 6 months. In most of these cases, patients with HIV tend to live longer because they visit their doctors more often and they're able to catch a lot of things earlier than if you would just go to your yearly checkup. After you have become undetectable or you are considered healthy, women with HIV can have children with a 98% chance of not passing the disease on to the child. However, you still cannot breastfeed even if you are undetectable. Once diagnosed by law, you have to disclose your infection to any medical professional, your doctors and your dentist, and to all future sexual partners. So if you ever want to come in contact with another partner along the way, you have to disclose to them. But if you do not disclose your infection to people and you knowingly have HIV, you can be punished by law. It's a Class A felony. I also included the law in this presentation. I'm not going to read the whole thing. Essentially, it says if you know that you have HIV and you come into contact with a person and engage in sexual penetration without informing the other party, then you can be charged with a felony. And then this is the law continued. And it just kind of defines sexual penetration along there. Where can you get tested for HIV and AIDS? You can get tested for STDs at your local health department, your doctor's office, and now they have tests that you can order online and have them shipped to your house, completely discreet and up to you. To prevent the spread of HIV and AIDS, you need to use sexual protection such as oral dams or condoms. Do not share needles for any reason. Abstinence or refraining from any sexual activities is the best way to prevent any type of STD transfer. If there are many medications that can help with the prevention of HIV. If you're sexually active, discuss these options with your doctor or gynecologist to find out which one works best for you. Because, like I said earlier, even with the HIV medications and the HIV preventatives, there's a lot of different medical history that weighs in on the medication you take. Dr. Nate Smith was a doctor at UAMS until 2020, and he is now working for the CDC in Atlanta, Georgia. I did the link for when he was leaving to work with the CDC, but he did work at UAMS, and he mentioned that UAM has one of the largest populations of HIV positive students in the state of Arkansas. And I'm not sure if you've noticed, but over the last several years, more and more billboards have been popping up about HIV protection, getting tested, or the PrEP pill, which is a HIV preventative pill you could take. And this is why. It's because Monticello is becoming a hot spot for this disease because students are getting it, transmitting it, and not knowing they're transmitting it. My sources are the CDC, the Center for Disease Control and Prevention, the former UAMS doctor and current CDC employee, Dr. Nate Smith, which is at the bottom right, and UAMS's current infectious disease doctor, Christine Patterson, pictured top left. And then I got the laws off the HIVjustice.net. Okay, that was my presentation. Thank you.